Before I talk about music therapy in the burn unit, for you to understand it, you're going to have to understand something about burns, because a burn injury is the worst disease that you can have. Not, as you'll see, the impact of a burn is incredible, but a burn that gets up to at least a third of the body or larger stresses the human body to its maximum level of stress. It's like an automobile engine that is tuned to, or a race car that's tuned to the maximum RPM that it can put out. And the car can't go any faster than that maximum RPM of the engine. And that's what a burn does as soon as it reaches a third or larger of the body surface. The metabolic engine, oxygen utilization, the function of all the organs, the heart has to put out 3 to 3.5 times the normal blood per minute. It is an overwhelming stress that young people can tolerate and old people don't. Not only does it ruin your physical nature, but it destroys every other part of your personhood. Intellectually, the patient cannot understand, no matter what we tell them, why they have to go through the ordeal of the dressing changes and the forced feedings and the surgeries and all the things that have to be done. The physical therapist has to exercise sore and painful joints, and the occupational therapist makes these poor folks eat, and their hands are all burned, and they say, how can I do that? And she sticks a fork in there, and they got to feed themselves. Things like that. The other thing is it destroys their spirit. And I don't mean in a religious sense. I'm talking the anima, that which gives us the life force. It's what Freud called the id. So how did we address this? How do you heal a person that wants to die, that's afraid of getting better, that doesn't want to cooperate because everything hurts? They're so afraid, physically, emotionally, intellectually deprived, and they feel unlovable. So we built on this premise. The human mind cannot concentrate on more than one thing at a time. Now, all of you are saying, oh no, we can multitask. Well, no. Well, let me tell you, you cannot concentrate on more than one thing. That's not possible. That's how music therapy works. Music therapy diverts the attention away from the pain and anxiety. Remember, pain is a cortical response. That is the cortex response. We have pain centers, the nerves that can go to the cord and then go up to and that's perceived as pain. The limbic system is where the emotions are. Okay? And the hindbrain is where we have the basic fundamental engine of life that we don't have to think about. Using music therapy, alternate musical engagement, music-based imagery, and entrainment, we can divert, you can divert the patient's attention so that they're concentrating on participating with the music, whether it's tapping their foot or humming the tune or singing the lyrics or whatever it is that the therapist finds that they can do with this patient while they're undergoing this painful procedure. They're able to do that. And you see, the beat and the rhythm is a response from the hindbrain. That's the sort of the pulse of life. And by using entrainment and slowly turning the rate, the musical, the tempo down in the music, and the patients, you can see, they start following the tempo, their breathing slows down, their pulse rate slows down, and they relax. Now, it's a trick to keep that person concentrating on the music and imperceptibly, slowly decreasing the tempo to entrain the the basic part of the hindbrain to responding without knowing it. And suddenly the patient's pulse goes down and the respiratory rate goes down and they feel better because the anxiety is abridged. Now, in order to get the insurance companies to pay for it, you have to show that music therapy actually impacts length of stay in the hospital, okay? Decrease the amount of expense for the drugs that they don't need. You've got to show objective proof that it affects medical care cost. So if the insurance company says, if we pay for music therapy, it's going to save us 2 days of hospitalization for cancer chemotherapy. 2 days in the hospital is like $10,000. Whoa, so a music therapy that earns $50,000 a year, that's a good investment because he's going to save all kinds of money for the hospital.